Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems, Better Care podcast. I'm here today with Dr. Bana Kashani. She is with South Coast Fertility Specialists in Orange County. Thank you for joining us today.
Thank you for having me.
Yeah, and just to get us started, give us some of your background, where you started, what got you into medicine, and then eventually fertility.
Sure. So basically, I grew up in Orange County as a probably teenager and high school. I was set on the pre-med track in college, but I didn't really know what I was going to exactly do. I knew I liked procedures. I didn't mind blood, but I hadn't figured it out yet. So through my training, I got to experience many different specialties and I found a liking to women's health. It just came natural for me. And then I was exposed to a little bit of the reproductive endocrinology and infertility side of things and saw how important it was to be there for couples or patients who were trying to start a family. And this would change the trajectory of their life. Being able to have a child is what so many people want and strive for. And unfortunately, life isn't always fair. And so there are circumstances where people would be great parents and they would have difficulty getting pregnant. And it basically was just like inspiring to me. I was like, this is what I need to do. And this is how I want to help and make a difference. And thankfully, I was able to get on the track of becoming an OBGYN or obstetrics and gynecology specialist. And I was trained at USC. I luckily had great mentors and had a great exposure to the side of infertility and fertility treatments and IVF. And then I continued my training at Rutgers, New Jersey Medical School, where I spent an additional 3 years. I did a lot of research, took care of a lot of couples who were trying to get pregnant. And then I came back to my roots in my hometown of Orange County. And here in Southern California, I've been able to really hone in on my practice and really trying to help couples here. So it's lovely to be able to wake up every day and do what you love and to see a meaning in what you do. So that's who I am and that's where I am.
Well, thank you for sharing that. And was there a particular moment, like as a resident or even before a resident, where you decided you wanted to get into fertility, or did it just happen one day? I'm always curious about that decision as a physician as you're going through your career.
Yeah, I don't think it was necessarily one day. In fact, I thought I was actually going to be a general surgeon, but then as I got closer into seeing women through their teenage years and then their reproductive lifespan and delivering, having children, the care that's provided, I felt like, this is something where I can relate to and I feel like I can make a difference. And then it was specifically understanding the side of all the technology that comes into helping couples, IVF, the in vitro fertilization, which is very new, and all the emerging opportunities to help couples with genetic screening of embryos, genetic testing, helping people have healthy children. And that basically seemed very inspiring to me. Like, this is the forefront of medicine and something that we can do and make an impact. And then, but I will say, once I was in the program and I saw how in certain situations life is just not fair. What I mean by that is I was training at LA County Hospital in USC, and it's a very busy hospital. And we were very close to an area of LA called Skid Row. And unfortunately, there were a lot of people there who were homeless or, drug abusers. And a lot of women would come in and unfortunately be on heroin or on other drugs. They would deliver babies. They would actually sign out against medical advice, go back to the streets so they can do drugs. And these poor children, these poor babies were left to hopefully become foster children to another family or be adopted. But it just seemed to me like this is not fair. Like, right? There are these people that are, wait to finish their careers and finally have children and then they can't, and they can't after a year or 2 years, and they're doing all these things. So I felt like it was my role and my duty to help get involved and see what I can do to help these couples. So that's what really pushed me to be able to pursue my fellowship training and my subspecialty training and do what I do.
And you mentioned technology too. I'm kind of curious in the fertility space because everyone's talking about AI and these nifty tools. Is there anything specific that your own practice is using or considering in this space? Just want to know more.
Yeah. So, I mean, there's a lot of new, everything with AI is emerging. I think one of the bigger things that came up during my training was just ultrasound ability to take measurements of follicles, have that transmit into the electronic medical records. You can be able to see flow sheets, see when patients' eggs might be ready to then take them out. So, that was one thing that's developing. But there are AI algorithms now out there that allow us as a provider to do an ultrasound, get the follicle measurements, and it'll predict, like, hey, this is a day for an optimal procedure or egg retrieval. So people are starting to use that at bigger practices. I've seen it at many conferences discussed and presented. I don't think I'm on that bandwagon yet. I still think that there's a lot more to it, and the algorithms still need to be developed. But that's something that's emerging. In the IVF lab, one of the coolest things that we have now is something called an embryo scope. And basically, this is an incubator where embryos are housed, and there's a camera, a time lapse camera on every single embryo in the lab. And right here, I have this thing where it basically shows what happens in development of an embryo from one cell all the way to this blastocyst. Now, in the embryoscope, we can see this in real time for every single patient. And it helps us predict, like, if the embryo is dividing equally from one cell to two cells, that embryo may have a better potential of being a healthy, normal baby versus ones that are unequally dividing. So this is also being utilized in the lab side of things to help us select better, healthier babies for children, for couples. And so that's a really cool and interesting thing that's available that we use on a day-to-day basis.
Yeah, and just comparing the two experiences before that, what did that look like before you had that capability?
Yeah, so that's actually a great question. Before that, we would have to take the embryos out on a petri dish, have somebody in the lab called an embryologist take that over to a microscope, look under the microscope, then put it back into the incubator. And what we found was this that movement potentially opening up the incubator exposes different levels of gases, temperatures. There's the dish is inevitably going to shake a little bit. That movement may not be good for the embryos. Keeping them in the incubator system, the same environment, same pH, all the gases the same, is probably beneficial as well for the embryos. So now we don't have as much movement, and it also helps the team members. They don't have to manually go into every single, incubator, take that patient out, and honestly, it reduces the possibility of potential errors that can come up, right? So it's incredible the amount of improvements that we have on the lab side.
Yeah, it sounds like it's saving you time and then improved accuracy, it sounds like as well, is a big
Yes,
bonus.
for sure.
Yeah. And then are there any downsides that you've noticed? We're always curious about that as well. Because I know AI in technology can only go so far usually. And then you have to have that human in the loop to interact and intervene.
Yeah, I mean, there are circumstances an embryo is a three-dimensional sphere, right? So
Hmm.
sometimes you can't see everything unless you were to, like, rotate the embryo. So sometimes in the embryoscope, it's a two-dimensional view. You don't get the best view. So that's a
Yeah.
limitation that we have, of course. On the side of doing ultrasounds that automatically measure follicles, you can mix up certain things. A follicle could be I'm sorry, a blood vessel could look like a follicle. And so we have some inaccuracies in measurements. So there are limitations. And I think this is why we can't just solely rely on AI. I think there still needs to be the element of, a physician or provider at play and overseeing everything and making sure that what we have, the information that we've gathered, is actually truly accurate.
Yeah. And another thing I was wondering, I just thought of as well is, I have a new patient coming in having fertility issues. What are some myths that you're dealing with right now when patients come in on their, misconceptions of what they're going to experience in a fertility clinic? What are things that they're talking about?
Yeah, so this can come in all regards. I think that some people don't realize how much of an impact male fertility has on the
Mm,
puzzle, right? And
yeah.
so, what I always try to tell people is that one third of the time there can be a male factor component. And although someone might state, well, no, I was married before and I had kids, that doesn't just assume that your sperm now is currently healthy and there's adequate numbers. So, never ever want any partner to skimp on doing a semen analysis. That's really critical. I think the other big myths is that as healthy as we are as, like, women, unfortunately, you still have a drop in your egg quantity, and starts at birth. to puberty. And then what happens is we're left with fewer and fewer eggs each year that goes by. And more importantly than the drop in quantity, we all understand this biological clock. It's the quality and how much the quality of the eggs changes with time. I always try to tell people, like, you could be a very, very healthy 40-year-old, literally eat so clean, exercise, don't smoke, don't drink, everything. But regardless, just as our skin cells change over the years because they're exposed to the environment, the sun, UV pollutants, the egg quality goes down. And so it's not an easy answer like, hey, I'll just do IVF when I'm 45 and it's going to solve all my problems. Or I'll be able to wait till I'm 45 and do IVF and I can get pregnant. There is an inherent true biological clock and it's all related to age.
I'm also curious too, like over time and through your experience, is there an environmental factor at all to infertility that you've noticed, or what is the research saying in what you're doing?
Yeah. So as much as I'll say age matters, environment matters too, right? So there are definite correlations where smoking, for example, over long periods of time or short periods of time is detrimental to both male and female fertility. Particularly, for example, women will lose eggs more rapidly if they're exposed to the cigarette smoke. They even go through menopause sooner. There's lifestyle factors that, of course, I think are so important. There's everything out there on our diet related to processed foods, right? Processed foods are detrimental. There's so many endocrine disruptors out there. BPA, which is found in plastics, plastic water bottles, cooking with heating up food in plastic. I mean, all of these are environmental factors that definitely impact male and female fertility. And I don't think they should be understated. I think whenever somebody makes a decision that they are on the track of wanting to start a family or conceiving, I think both the male and female partners should be on board to kind of do as best as they can to, be as healthy with their diet and all factors within their lifestyle.
Sounds like there's a lot of different pieces to the puzzle to increase the chances of, having a baby, Also
Absolutely.
curious as well from like a market perspective. I know there's a lot of things with like social media and people are talking about big topics. I know acetaminophen is a big one right now. Curious to get your impact on that and help educate us there in that areas.
Yeah, I mean, overall, I think the social media impact is actually great. I think that it's providing people with a lot of information that otherwise wasn't available. People are curious about their fertility and going in and actually getting the right tests done. And it opens a conversation to think about like, well, could I be in a situation where it's difficult or maybe I should go seek care? So I love the fact that social media educates patients, allows them to come in and basically start the conversation, and I'm open to anything that they bring up. Of course, with that being said, there are things that come up that become hot topics. And obviously, as you alluded to, one of the big hot topics is this conversation about Tylenol during pregnancy or early natal life and how this is linked to neurocognitive disorders such as autism or ADHD. And I am a little disappointed with how this basically became viral and this hot topic because unfortunately, there was one study or a couple of studies that are not really the best quality research studies. And what I
Yeah.
mean by that is that there's a lot of confounding factors, and they relied on something called recall data from patients. And basically, they showed a possible correlation, not causation. And that's very different. So basically, they're stating that Tylenol ingestion during pregnancy will cause autism. But that's actually not what the studies is saying. There may have been a possible correlation. But again, we're relying on patients who provided recall information. Hey, when I was pregnant, I took Tylenol. And sometimes that isn't as accurate when you're thinking back 5 years from now, right? And how
Yeah.
much Tylenol did you take? So the bigger studies that are better studies that were more controlled actually don't show a causation. And I think that
Hmm.
that's so important because thankfully our two big societies, the American College of OBGYN, as well as the Society for Maternal Fetal Medicine, SMFM, both have put out very strong positions and statements stating that there is no causation and patients who do need Tylenol for appropriate indications, and I can talk about what that is, should still take it.
Yeah.
Fever is a big problem during pregnancy. And if one has a fever, the first thing their provider will recommend is Tylenol and cooling measures to bring down that fever, which can cause birth defects and miscarriages and preterm delivery. So it's thankful that our two societies have put out the statement that it's safe to still take for fever or pain. Women shouldn't also suffer in pain while they're pregnant just to avoid taking Tylenol. So I think it's about a balance, but I wish it wasn't so strongly, put out there in the social media and other people who claimed that Tylenol is unsafe to take.
Yeah, dissemination of the information, like, and for example, you called out correlation versus causation is very different as well in the research. So that's an excellent delineation for the audience. And kind of closer to your own practice as well, are there particular fertility patients that you see? What are the trends that you're seeing as well right now in the market with patients and what their needs are? Kind of curious about that too.
Yeah, so I think that the trend is that most people, most women are postponing getting pregnant or having children. So postponing childbearing till they finish up their education, they're settled in their careers, and they really want to set themselves up in life to plan children at the right time, which is so responsible, right? But with that being said, unfortunately, I see a lot of people who start trying to get pregnant after the age of 35 or even at 40, and that's a really difficult situation because not only is the egg quantity or quality lower, it just gets harder to get pregnant with any kind of treatment. So that's the biggest thing that I'm seeing in my area. There is a big uptake, thankfully, of also women who have gotten educated through social media and are seeking fertility preservation. They're interested in egg freezing their eggs, putting them aside, and then being able to say like, hey, I've done something for myself and this is a backup available to me in case I can't have children in a few years. So those are kind of like the big areas that I think we see a lot here in Orange County, and different patient populations, of course, but I think that that's pretty um, commonplace now.
What kind of decisions are couples kind of dealing with right now as they come in your clinic? I'm also curious to hear that as well, is like how you help them be the kind of the decision maker or the any intermediary in those conversations. Like what are some examples you could talk about?
Sure. So I always like to obviously have both the patient and their partner, so couples here together, sitting with me, and we really first map out what are their family goals, because having one child, is important to a lot of people, especially if they've had to postpone and they have had trouble getting pregnant. But some people really also have a vision of not only one child, but two or three children. So I think that first we need to establish that. And with that, then we can kind of map out different treatment options. I always start with what is the most closest thing to getting pregnant naturally? What's a little boost? What's a little bit of assistance that we can provide? And then what is the kind of not most extreme, but most more aggressive form that's further away from getting pregnant naturally, but might have the higher success rate and might actually allow you to plan for your future family. If you're coming to see me at 40 and you want three children, well, I don't know if it's going to be possible to conceive your third child when you're 45 or 46. Maybe IVF actually might be better because then you can freeze embryos and bank them for the future. And it's better to do that now at 40 than postponing, 41, 42, or even later. So these are the kinds of conversations that we'll have as we plan out. And we navigate that together. There are religious considerations, ethical considerations. There's a lot of things that might not work for the same, for two couples. So we always have to consider all of the factors at play and what people feel comfortable with.
Yeah, and sometimes I've heard too, when patients come in thinking they have to go right to IVF, right? And I know that's not the only option. What are the options for people when they work with you?
Sure. So we can just focus on optimizing natural fertility through an assessment of hormones, assessment of the uterus, fallopian tubes, and ultrasound modalities. So we can make a plan in terms of diet and lifestyle. That's one option. Another option is we can do assistance with ovulation. Some women don't really actually regularly ovulate, so we have medications available for that. Alternatively, sometimes people are ovulating, we give a little bit of a fertility boost with some pills that might help them ovulate a few eggs, 2 eggs, 3 eggs. That might be beneficial and helpful for achieving a pregnancy. We have options of helping with getting sperm closer to the fallopian tube. So this is through something called intrauterine insemination, or IUI, where we take a sperm sample and we can wash it, concentrate the better swimming sperm, and get it closer to the site where fertilization will happen. And then, of course, yes, there's IVF as well. So these are the kind of like stepwise approaches to being able to proceed. And not everyone does IVF, and it's not recommended for everyone. And I think that's one of the myths that some people, have a little bit of a hesitation to come in for a consult because they think, oh, I'm going to have to do IVF. But honestly, in my practice, that's far from what happens. And we definitely tailor our treatment options to what works for each couple. And it's normal. They've heard a bad story about IVF. They're scared. They don't want to do it.
Yeah.
And I immediately listen to their concerns and I'm like, okay, we will do everything we can to not go that way. Right. So these are the paths and these are the options that we can utilize to get there. So,
That's great to have options. And then another thing I was going to ask about too is, again, back to social media. People try taking vitamins or pills, or they hear something in a reel and they kind of make up their own regimen to increase their fertility. Is any of this true, or is this just kind of nonsense that people are just kind of desperate to try? I'm just curious as well if you recommend anything like that that's actually helpful in the process.
yeah, thanks for bringing this up because it's a very hot topic.
Yeah.
There's been a lot of research studies that have looked at supplements to improve egg quality, and they are kind of all over the place. And it's probably
Hmm.
a factor of supplements are not regulated by the FDA, and so it kind of depends on your source of where you're getting them. But there are a few supplements, sorry, that can be helpful for fertility. One is coenzyme Q10 or CoQ10, which is an antioxidant, and that definitely can likely help egg quality. We're also identifying that it can help sperm quality as well. If somebody is low or deficient in vitamin D, absolutely supplementing with vitamin D can be beneficial. Some women with polycystic ovary syndrome or PCOS may benefit from a myo-inositol supplement. So there are definitely supplements that can improve fertility. I think where it's a little bit difficult to navigate is there are some people that will take 10 supplements, right? They're like, I found,
Wow. Yeah.
NAD and CoQ10, resveratrol and vitamin D and fish oil and zinc and vitamin E, and their list is really long. And not to say that that's bad, but you have to understand that sometimes it's like too much of a good thing, right? So what that means is that what if you're getting extra from your prenatal and then you're taking this extra supplement, and is that actually helpful? Or where are your sources of your supplements coming from? And what else could potentially be in there that might be negative for fertility? So you have to keep this in mind. So I think that it's important to share it with your doctor and kind of, I'll see people's lists and I'll be like, this is great. This is awesome. This is good. Please, like, I don't think we need ashwagandha, for example. Again, not to say that's bad, but I'm just giving examples of what we do when people come in for consult. Interestingly, I think that there are a lot of different companies out there that are understanding how fertility is so emotionally taxing. It's so
Yes.
isolating. It's so challenging. And they're putting out a lot of targeted ads and media to these very vulnerable people and patients. And they're promising, like, hey, you don't need any kind of, medical treatment. All you need is this fertility powder, and you take this every single day and it's going to work for you and you're going to get pregnant. And they have somebody on there that says, I did this at 43 and it worked. And it's very unfortunate. I'm not to say that I can absolutely guarantee that won't work, but I think that we have to be realistic and I think very, very cautious of, really accepting what's put out there because unfortunately, a lot of times those things don't help and they end up causing you to postpone getting evaluated, postpone treatment, and unfortunately spend a lot of money on things that might not.
Yeah, it's a very emotional experience going through. I'm sure most families have heard of someone maybe in their immediate family or, brother or sister have gone through this experience. Do you have any recommended resources for people, like if they're just very stressed or someone to talk to? Because I'm sure, like, if you're not immediately available to come in for an appointment, what are some options that patients have to help support them? Like maybe they wake up in the middle of the night and they're just very worried and stressed. Curious how you manage that. And a productive fashion.
Yeah, every single fertility patient is under stress. There's just no way they're there. And so having the appropriate resources is very important. And not everybody has that through just their partner or their, spouse. So there is a amazing organization called Resolve. They have support groups. You can go online and there are local support groups where they meet in person. There are virtual support groups. And I think support groups are amazing because nobody understands what you're going through and the pain of an infertility journey or pregnancy loss experience the way that someone who has walked in those shoes experiences. And so knowing that there are other people going through the same thing can be very helpful. You can share stories, you can share the highs, the lows. That is very, very helpful. Acupuncture can be very helpful to kind of take the mental load off of things and have some time to de stress. And there are certain acupuncturists that focus on fertility, which is great. Having a specialized therapist that works with couples for either pregnancy loss or infertility is also really, really beneficial. So I think that I always suggest patients consider that. Sometimes they know, hey, my pregnancy test is scheduled today. I'm either going to be elated or it's not going to be good news. I'm already going to
Yeah.
schedule a therapy appointment just in case. That's really helpful. And then there are actually apps available to women who are, or even men, it's called like Ferty Calm. And basically, it provides you strategies to do self guided meditation during moments where you are kind of burdened with that extreme anxiety. Like you said, it's the middle of the night. You can't stop thinking about my pregnancy test coming up. And so you can again walk yourself through some of the self guided meditation, and that can be helpful. So there's lots of resources. Not one thing works for everyone. And so
Yeah.
sometimes you try one thing and another, but I think it's really important to know those options are available.
Yeah, and another stress that people talk about too is paying for the treatments and trying to get through that and how to manage that appropriately. Are there kind of equal resources out there that people can go to for help? And I know everyone's in a different financial situation, so I'm interested in that as well.
Yeah, so this is obviously IVF. You hear these stories, it's just so expensive. It's a huge
Yeah.
financial and it really is. So, depending on the state you live in, there are certain mandates that are now out there in certain states that do provide coverage for fertility treatment or at least the workup. So, that's first and foremost, see what your state offers. Regardless of that, each employer may have an offering of insurance coverage for IVF. So if you have any questions, you can always ask your employer or human resources department. But if that's not an option, then there are always grants available online. So there's lots of organizations that provide grants for fertility treatment. You can Google it, and I've had patients be successful in getting things covered. But there are a lot of other new programs out there too. There's Bundle, Gaia. These are different kinds of organizations that provide fertility coverage for patients, and you can kind of get a loan. There are IVF loans available. Patients sometimes will get a low interest credit card and help that with pay for their treatment and just pay things off monthly. So there are different options available. I wish that coverage was more accessible and everybody had insurance coverage, but unfortunately it is really dependent on the state. Thankfully, it does seem like it is in the works that a big pharmaceutical company, AMD Serrano, is working very hard to reduce the cost of at least the IVF medications, which can be a lot.
Mm,
Medications
yeah,
alone
I'm
can
sure.
cost $2,000 to $7,000. So I think that we're nearing more and more of being able to make things more affordable for people who don't have insurance.
Do you think the pricing, I'm curious too, is it because it's not as widely available, so the pricing's so high? Because I'm trying to think about scalability to make it more available to more people. Just curious on your input on that as well.
In terms of the actual IVF treatment
Yeah, just making
or
it's
the
more about
medication.
patient
Or
accessibility. Yeah, it's more
yeah,
about
I mean,
patient accessibility.
yeah, so it's probably twofold. One is, yes, patient accessibility. There are not a lot of infertility providers. If you look at nationwide, we are it's a very subspecialized field. So that's one. Number two, though, it really comes down to more, I think, with thinking about the things in the lab. I mean, every single patient's embryos has to be babysat in the lab. I say babysat, but like literally the technical skills of an embryologist are so immense. And so it's not something that we can just put, we can train anybody to do. And so I think that it's just we're dealing with like very, very sensitive tissue and culture and all of these elements that are so important. And we just need very specialized people to work on it. So it's just not scalable. You can't just open up a center at every single corner and make it more
Yeah.
affordable.
And I know as a physician too, you go through medical school and you're not always taught like how to set up the business side. So I'm curious, like, how did you figure that out? Like, how did you find an embryologist or how did you find these very specialized people? Because I'm sure the people that are maybe going through the training now, they're curious how you did that. Just want to get your perspective.
Yeah, so I think that it's really hard. A lot of the time it's word of mouth of kind of finding the right fit
Yeah.
for your practice and finding people who are like-minded with the goals. The goal is for patients to be successful. And that is the first most priority. And all of our team members, I'm so thankful and blessed that that's what they do. They come to work every day. They see that vision of how incredibly important their role is as a team to ensure success. And that comes from our front of office staff, medical assistants, like you said, the embryologist in the lab. Everyone's goal is like, how can we make this patient's experience successful and do our best? And so I think that that's what really makes the difference and what we look for as I've set up my business and had my team, because I can't do it on my own at all. I rely so much on my team and it's critical.
Are there other points in the fertilities, market you can think even bigger if you want outside your own clinic that are just particularly frustrating to deal with? I'm just interested as well of what you run into day to day.
Sure. So I really find this area of medicine incredibly sensitive and emotional. And
Mm-hmm.
I unfortunately have seen people go to other practices and come and tell me, or I've seen it myself, where they just feel lost. They feel
Mm.
like a number. They don't feel like they're recognized. They are
Yeah.
receiving a treatment option that's very cookie cutter. They may not see their provider. When they walk in the door, people don't know who they are, they're not welcomed. And it just makes it feel so much more isolating. And I think that that's so important, the mind body component, right? You want a positive experience because that manifests into hopefully a positive result or positive response to treatments. We really are, I think, set ourselves aside and we're unique in the fact that when you call the office, you're not getting a recording, right? You are getting somebody answering the phone, taking care of you. And that experience trickles into the patient experience when they walk in the door. They know their nurse, they know their coordinator, they know who they're seeing, they know their journey, right? And not having to repeat that and tell someone else, well, I just had a miscarriage, right? Like that doesn't, you should, when someone comes in and they've had a miscarriage, the first thing you want is someone to look at you and say, I'm so sorry about your loss. How are you?
Yeah.
Not, oh, well, I'm not pregnant anymore. You don't have, like, it's those things I think make a huge difference.
Yeah, your approach with the patient. And I've heard that as well as sometimes in a fertility clinic, they may never see the physician, even through multiple pregnancies, which is unfortunate. Is that something unique that you make sure to make a point to meet with all your patients so they see your face and know who they're working with?
Yeah, absolutely. And thanks for highlighting that. I mean, I think the biggest difference in my practice is that I see every single patient. I scan my patients myself. I allow them the opportunity to come to my office and ask me
Mm.
questions. I think that face-to-face interaction is so important. Otherwise, you're basically leaving the office with question marks and you don't know what's going to happen until the afternoon, until someone calls you and tells you what to do. And that's the last thing anyone needs. They're already stressed. They're already having they're dealing with hormones and injections. People want to feel reassured when they walk out the door, not left with questions. And I think that that's what I've done in my practice and my colleagues do is we try to make a different patient experience.
Yeah, sounds like it's very unique, which is really exciting. What are some other things or feedback or tips for others in this space? It might be just starting out. Like, how can you make that experience even better? Like, you can think about the ideal. Maybe it's not something you're doing yet, but something that could take you to the next level that would work really well.
Yeah, I think first off, there's no harm in getting like a second opinion. Go with your
Yeah.
intuition. Know that you feel comfortable wherever you're at. And that has to do with, not only your doctor or provider, but the office setup and go with your intuition if you feel like this is the right fit. But I think the next level is no matter where you're going and what kind of provider you're seeing in medicine, you have to be your own patient advocate, right? Nobody knows your body more than yourself, no matter what,
Yeah.
right? So if
Yeah.
you feel like you know something, like something's not adding up, like I feel like my cycle on this last day is always off, and maybe I have a hormone issue, you can voice that to your provider and you should be heard, right? Or if you found something very interesting and you have a question about a potential treatment option or a medication, you should be able to feel comfortable to talk to your provider and be your own advocate. Maybe something could work for you and you just need to bring it up. And I think that that is a game changer and could very well change the trajectory of your treatment course by just speaking up. No one's going to be offended. And in fact, if a doctor or somebody is offended, I think then maybe that might not be the perfect fit. Like, no one should be
Yeah.
offended by someone asking a question or suggesting something.
And how do you do this as a physician as well? Is like, how do you create that comfort so then they can open up? Is there like a specific structure you have in your conversation, or like how do you establish that? Because that is really hard to get right away, build that rapport with that person to get them to open up. So I'm just
Yeah,
curious about what you do in the fertility space.
sure. So I always allow patients to first like feel like they can just have a conversation with me. Of course, that doesn't come natural. So sometimes during the part of the consult where we're asking questions, I make sure I say, "Is there anything else you think is important for me to know that I might not have asked you, or my portal questions didn't ask you?"
Yeah.
Maybe something's been on their mind. They didn't have a spot to write it in when they were filling out the questionnaire, but looking at them in the eye, maybe, they were like, yeah, actually, I wanted to tell you this. So that's that. And then obviously, leave lots of room for questions. I know people have a list of questions. And then finally, the conclusion of my consult, I want patients to know that I have a patient portal. They can download an app on their phone. They have access to sending messages to me directly. And I say, inevitably, you're going to leave this consult and you're going to have questions. And that's what we're here for. So please utilize that ability to reach me, ask me questions, ask our staff. That is what we're here for. And I think if patients hear that a couple of times, then they're like, okay, well, I feel like I can actually approach them with this question. And so I think that that's relieves some of their concerns or anxieties.
Yeah, because everyone has different communication styles, what they're comfortable with. They might want a portal message. They might want to talk to you in person. They might want to, call you on the phone. There's different ways to do that.
For sure.
And is there like a telehealth component to your practice as well, or is that being utilized, or how does that look today?
Yeah, so we are able to provide telehealth services and do virtual consultations, get workup started. So that is definitely an option. Very frequently, though, we will have people come in person because we're doing ultrasounds and we're going to see patients while they're in their treatment cycles. But thankfully, if somebody does live far away or is, traveling for work, we do have options of, doing telehealth phone calls and virtual visits and setting up what's called outside monitoring. If they need to go get an ultrasound or lab work elsewhere, we can wait for the results and still make some medical decisions for them. But if you're in treatment, oftentimes people will come here and spend some time here so that we can do their procedures for them.
And as we're in the end of the podcast here, I was asked this question: if you had a magic wand in this fertility space market, what would you want to fix today?
That's a good question. I really, really would love for all patients at all clinics to have a more personalized approach with fertility care. I don't want, it's such a hard journey. It's so sensitive, so emotionally taxing, and people should really feel like they're being heard and feel comfortable with their clinics and offices. And I don't know if that's the case everywhere. So
Yeah, it sounds like might be a little raw to say, but almost like a factory mentality is like, this is what we do for everyone. You never really get to meet the doctor. This is just how we do it. That's kind of like the horror stories that I've heard in the past, unfortunately. Is that kind of what you're talking about?
yeah, that is unfortunately. But I have a
Yeah.
second wish. I have a
Yeah,
wish to
go for
set
it. Yeah.
higher success rates. We've made great progress over the years of improving success rates during IVF and embryo transfers. And I can only hope that as the field advances in the next 5 to 10 years, our success rates will be even higher because it's a lot to go through and not be able to walk home with a baby. But I hope that every day research continues to advance and we continue to develop more so that we can have higher success rates for our patients.
Yeah. And just another question too. What has it looked at like over like even the past 10 years? Like what's the difference between 10 years ago and now for success rates, looking at like maybe IUI, IVF? I'm curious about that too.
Yeah, I mean, unfortunately, IUI success is probably pretty similar. It depends on
Yeah.
your age, but between 10 to 20% success per cycle. For IVF, I think that there's a lot of controversy over pre-implantation genetic testing or PGT testing embryos. But for a lot of circumstances, the benefit has been that we're not putting in multiple embryos into patients. And so what that means is these are healthier pregnancies. We're not dealing with twin or triplet pregnancies like we were 10, 20 years ago, which are really problematic for mothers having preterm deliveries, babies ending up in the ICU because they're preterm. So I think the movement towards what's called elective single embryo transfer, putting in one healthy tested embryo, has been really, really amazing for improving, neonatal outcomes, obstetrical outcomes. Critical. That's critical for all of the future generations to come. So that's great. And, I think we still need to advance a little bit more in pre-implantation genetic testing. But for couples who've had multiple miscarriages due to chromosomal issues, being able to identify an embryo that does not have Down syndrome or other chromosomal abnormalities and using that embryo to transfer, I mean, that's huge. And that's what's improved our success rate
That's a game
significantly.
changer. Sounds like, yeah. How old is that you call it PGT? How old is that? How long has that been used so
PGT
far?
has actually been around for over 10 years, closer to 20 years, but the platform of technology has been improving. So now we have
Hmm.
what's called next generation sequencing, which is more advanced, and we biopsy the blastocysts, the cells that become the placenta rather than earlier on. So over the years, we're just improving our ability to detect chromosomal issues, but it's still not perfect. It's still a screening. And so I think that in hopefully the next 5 to 10 years, we'll get better and better.
Yeah, it sounds like that's definitely the case, especially year over year. And then now we're at the end of the podcast. Where can people connect with you to learn more?
So you can visit us on our website, which is southcoastfertility.com. You can also find me on my Instagram, which is Dr. Bana Kashani, BanaKashani. And I'm happy to connect with anyone and help anyone that I can.
Excellent. Well, thank you so much for your time and your insight. Our audience will get a lot out of it. So thank you so much.
It's been an absolute pleasure. So nice talking to you. Thank you.
You as well.